On behalf of the Coalition of Societies for the Rights of Older Persons in Nigeria, a coalition of everyone who is in aging in Nigeria, I want to welcome everyone across the continent for this webinar today, elder abuse. I am excited that you've all joined from all over the world because issues of older person and abuse is a global issue. So I welcome you all. Thank you very much.
Yes, our next speaker is the Honorable Minister for Humanitarian Affairs, Disaster Management and Social Development, Honorable Sadia Omar Farouk, who will be at this point represented by the Director General of the National Citizen Center, Dr. Ms. Omokaru. She will be addressing us at this time.
Thank you very much for that introduction of the Honorable Minister. I come on behalf of the Honorable Minister for Humanitarian Affairs, Disaster Management, and Social Development. I bring greetings from her ministry and of course her unalloyed support for the work as it concerns older persons. And here is her address. I recognize the Honorable Minister of State for Health. I also recognize the President of the Coalition of Societies for the Rights of Older Persons, Senator Dr. Ezel Job. I recognize the coordinator of this program, Architect Victoria Uno. And of course, let me recognize all the distinguished speakers who are here to do justice to the theme of the 2021 World Elders Awareness Abuse. The International Day of Older Persons was established 14th December 1991 by the United States General Assembly and celebrated every June 15th. We are here today to mark this auspicious day, and I welcome all of you actors in the field of aging. I welcome all of you advocates for the rights of older persons. Old age, as we know, brings about health challenges, to a large extent, decreasing functional capacity, which may affect the sense of well-being of older persons. In this regard, the goal of the care of older persons in the society may not be without challenges, both to older persons and also to the duty bearers. I wish to state that the Ministry of Humanitarian Affairs, as a whole, Nigeria recognizes that it is during the course of life that older persons face much abuse, either by neglect or with willful physical or emotional torture from close relatives or from the larger society. And this gets forth where older persons lack, where they are vulnerable and they have need and, and no recourse to remedy or to redress. The emergence of COVID-19 pandemic across the world caused untold hardship to older persons. and caused the globe to look at the inequality and inequities to access to health across the globe, and how that over the years has affected older persons. And in recognizing that, even the UN International Plan of Action declared that abuse of older persons have become a global health crisis. In the recognition of the rights of older persons and the need for age equality, the Nigerian government has put in place institutional, legislative, and policy processes to ensure strong foundations for the takeoff of programs and activities that would address, the numerous challenges of older persons, that which for the last many years had really been in the deficit. Of course, we would recall that this year, the National Policy on Aging was approved by His Excellency, the President of the Federal Republic of Nigeria, Muhammadu Buhari. And of course, this year, June 7th, the Senior Citizen Center Act, which had been signed into law by the President, had its board inaugurated and the Director General appointed. This goes to show that in many ways, Nigeria is setting the stage and putting all the necessary institutional, policy, legislative framework in place to tackle and to address the numerous challenges of older persons. This year's theme, which is access to justice, really, in reality, refers to older persons' ability to approach the courts and seek redress, the ability to get representation, and of course, the ability to get their voices heard and to seek remedy and redress for situations which had denied them their rights. But I would go further to say that access to justice is much more than seeking redress. Access to justice begins critically from laying the foundations for equity, the foundations for social justice, and the foundations for freedom, independence, autonomy of older persons. And that comes by providing programs and activities, providing support services to especially the group of special needs, the group that society seems to have forgotten, and the group that may not be able to speak for themselves. So access to justice for the Nigerian government would for us refer to putting critical regulatory framework and mechanisms to enforce justice for older persons in place, putting together, access, very easy access, age-friendly, communities, age-friendly societies that allow the participation, inclusion of older persons and allow their voices to be heard. In that sense, I would want to welcome all the stakeholders in aging, the Coalition of Societies for the Rights of Older Persons, and the professional, the experts in aging to join hands with the National Senior Citizen Center to ensure that the older persons of Nigeria fully take advantage of the national policy that is made available, which is going to, in a short while, be translated into National Implementation Plan. And of course, the National Senior Citizen Center, which is named after the senior citizens, showing ownership. Older persons should take full ownership of the National Senior Citizen Center. Older persons in a short while will be able to have support services, will be able to engage with the National Senior Citizen Centers. And also even older persons, especially in the rural and remote areas, will have access to facilities, to programs, to activities, and have access to seek redress, access to justice. Because I believe that the National Senior Citizen Center will set out procedures, mechanisms in which support for older persons to fully enjoy their rights, their independence and autonomy will be put in place. On that note, distinguished ladies and gentlemen, I wish to thank you for all the work you have done over the years, especially in Nigeria. And I want to also recognize actors in aging from across Africa. I know the work that the stakeholders group on aging has done across Africa. And I want to welcome you actors from various countries, actors within the region, within the regional framework, actors, even global actors, up to the United Nations, fighting hard for the rights of older persons. As we observe today, International Day, World Elder Abuse Awareness Day, I wish that we would take time in this webinar to access the social, cultural, economic situations, to access stereotypes, prejudices, discrimination, neglect, violence, and all the very, very, exacting conditions that older persons face. And at the end, the National Senior Citizen Center would like to share in your recommendations. We would like to continue to work with the Coalition of Societies for the Rights of Older Persons and all the professional bodies in Nigeria to ensure that the mandate of the Senior Citizen Center, which is to provide for the dignity, security, and well-being of older persons, to enhance their capacities for continuing engagement in society, which is to say that that mandate is indeed fulfilled. Thank you very much, and have a very fruitful deliberation.
Thank you so much, Dr. Omokaru. We're so honored to have you represent the Honorable Minister. Thank you. And I know that you're going on to the next event that you have, and we'll be listening for it. We'll keep on announcing for it also. Well done. Thank you.
Thank you very much.
As we go on now to take on the keynotes, to take on the address by the Honorable Minister for State, Ministry of Health, who is ably represented by Dr. Nneka Orji.
I'm in a meeting.
Dr. Nneka Orji, please.
Right. Yes, thank you very much, Madam. It is a great pleasure to be part of this meeting and humbly representing my boss, Senator Dr. Adeleke Olorunnibe Mamora. He is in another meeting, and he has graciously asked that I represent him in this meeting. I recognize the presence of all of our invited dignitaries, the representative of the Minister for Humanitarian Affairs, the President of Cosropin'S, other distinguished guests from Nigeria and beyond. And I beg to stand on all other established existing protocols. So I have your permission to read the address of the Honorable Minister of State for Health. I am very delighted to be part of this remarkable day commemorating the World Elder Abuse Awareness Day in Nigeria. I say this because this recognition and commemoration stands out because it is an intervention for us and by us. What do I mean by that? As long as you have crossed the age of 50, 60, you belong to this group. And as a person who has crossed this age group, I believe I also, by extension, belong to this group. So that's why I say that this intervention is an intervention for us and by us. At the Federal Ministry of Health, we remain committed to institutionalizing and sustaining all efforts and interventions and partnerships that will foster a renewed approach to meeting the needs of the elders, whilst also avoiding and preventing all forms of abuse, intended or unintended. The Federal Ministry of Health is currently expanding the focus and interventions to address geriatric needs across the country through geriatric centers across the nation. We are using a phased approach to ensure that, first of all, we have it in all of the geopolitical zones, and then we can ensure that it is situated in all states of the Federation. We cannot say we totally know everything about all of the needs of the elderly, and so we remain committed to having open conversations and engagement that will ensure that we are well informed and well equipped to meet all of the identified needs. And in doing this, we are open to partnership, especially from other government agencies, considering the fact that the needs of the elderly people spread beyond the health sector. So those critical partnerships are very essential for us to meet the needs of these very unique citizens. And we're also committed and open to partnering with the private sector as well, considering the fact that in recent times, we've been able to identify the huge potential that the private sector brings to the table, especially in ensuring that adequate access is created for all and sundry. And also, we're also open to partnering with other international bodies that work in the area of ensuring access to adequate and quality healthcare for the elderly. We're also currently expanding health insurance coverage to ensure that the needs of the elderly and older ones are adequately covered. Again, despite the fact that there's a global pandemic which has impacted on the physical space of countries, regions, and different entities. But we are working assiduously to ensure that in the spirit of universal health coverage, we do not leave anyone behind, especially our elderly people. The National Health Act has mandated that the Basic Healthcare Provision Fund shall fund a benefit package that shall be enjoyed by every Nigerian, and we recognize the fact that that also includes the elderly population. And so in defining and redefining and adjusting the benefit package, we're committed to ensuring that the needs of the elderly people are taken care of. We will continue to work and collaborate with groups to ensure that the interests of the elderly are prioritized. And they're not just prioritized, they are met. we want to eliminate unmet needs for the elderly group. And so we're committed to prioritizing their needs and ensuring that they exist within communities without having to, experience any form of abuse, especially in terms of not having access. Because for us, access to justice is also access to essential health care for the elderly. And we're committed to ensuring that we achieve this goal. So on that note, I want to sincerely thank the conveners of this webinar for finding us worthy to be part of this conversation. And we will sit back and listen such that we will get all of the facts that we will need to advance all of our interventions for our elderly people. On that note, I want to sincerely wish every one of us a very fruitful deliberation. Thank you very much, and over.
Thank you so much, Dr. Oji. Thank you for making our time to be here representing the Minister of States, the Honorable Minister for State in this occasion. You're very welcome. Thank you. Our time is fast spent, and we need to kick off at a fast speed and take on the first speaker. She is a senior advocate of Nigeria and presently a senior partner in Adeboyega Awomolo and Associates. She has served in public service in many states of the Federation. She is a member of the Nigerian Bar Association, International Bar Association, Commonwealth Lawyers Association, amongst others. Join me to welcome Victoria Awomolo San. You're very welcome. You have the mic, please. Can we have, yes, thank you. We can't hear you. Can you unmute yourself? George, we can't hear you. Chief Mrs. Victoria, we can't hear you. Something is wrong with her mic. While we sort out.
No. Can you unmute yourself, madam?
She's unmuted. It must be a network problem. Okay, while she sorts out her mic, there must be something wrong with her mic. We'll be taking on the next speaker. The next speaker is from Rwanda. And she is the founder and president of Nsindagiza organization, a Rwandan aging platform. Rwanda Leaves No One Behind Network and the co-founder of Great Lakes Aging Network. He is also a member of Stakeholders Group on Aging Africa Steering Committee, that is SGA Africa. We'll be having Mr. Eli Mogabowishema to take the mic.
Okay, thank you very much.
Thank you.
Thank you very much. Honorable government officials, President of Cosropin, moderator, fellow discussant, ladies and gentlemen. It's my pleasure to be part of this forum to share with you the justice system for other persons in Rwanda. This is something that participating in this forum is really an honor for me, and that is why I first.
Hello?
That is why I first.
Hello?
Allow me also to congratulate the newly appointed. Talking to justice system in Rwanda, first of all, let me tell you that in 2020, other persons were around 6% of the Rwandan population. And that in Rwanda, there are two types of registries that are accepted. The first one is the traditional judiciary performed normally by elderly people. Another one is, of course, the modern one performed by trained professionals. These two are both accepted to referral to higher levels. In Rwanda, there exists what we call Maison à la Justice, home to justice, established by the government of Rwanda to assist the vulnerable people who can't afford a lawyer, and most of them are older persons. This is really a good point, and this is known in the community. The current national older persons policy would enhance access to justice for older persons. This policy was approved by the cabinet on May 1st this year. What I can say also is that in Rwanda, like elsewhere in Africa, there is a false belief that other persons are respected and cared for by their families and the community in general. That is what we think. Contrary, the practices are different, as there are cases of other persons who are beaten and even killed by their own children, asking them to hand their property over to them. And I can understand also how we can say that we love them, we honor them, we respect them, while the government, our government, are not supportive to the UN Convention for the Rights of Other Persons. African countries are not ratifying the African Charter on the Right of Other Persons. Most of our countries do not have the national policy for the right of other persons. They don't even apply to the universal health aging and to the decade of health coverage and aging. So all these things, we cannot see this just like that. We should show it in practice. The gaps that I want to share with you, first of all, is though there are some mechanisms providing support, like information to fully provide to them. To formal plans, place plan, of reverse technology. And they have, there is need for all the persons to have a section that helps them in the judiciary. Otherwise, we have the specific chamber for children and other people, but there is nothing for other persons. So this is what I wanted to share. We congratulate the Rwandan government for having ratified African Charter, and the cabinet to approve the National Older Persons Policy. Thank you very much.
Okay, thank you very much. That was very, very informative.
You're welcome.
It's wonderful and strange that the beating up of older persons also happens in Rwanda. And it's also good to note that the government also is not quite supportive to the UN Convention. As we continue to listen to other people and understand what are the gaps they have, we'll at this point call on our speaker that I introduced earlier on, Chief Mrs. Victoria Amowolo. You may unmute your mic now. Thank you.
Yes, can you hear me?
We can, yes.
Oh, okay. Thank you very much. Good afternoon. The Honorable Ministers of Humanitarian Affairs and Disaster Management and Social Development and the Honorable Minister of State for Health has ably represented the President of Cosropin, our dear moderator, fellow discussants, ladies and gentlemen. I want to thank you for inviting me for this webinar, which is a very important one at that, because all of us are going to grow old one time or the other. In defining what elders abuse means, there's no generally acceptable definition, but the International Network for the Prevention of Elder Abuse states that elder abuse is a single or repeated act or lack of appropriate action occurring within any relationship where there's an expectation of trust, which causes harm or distress to an older person. The act may be that of commission or omission and can be described as abusive, neglectful, or exploitative, either intentionally or unintentionally. But in most cases, this results in unnecessary suffering, injury, and pain, loss of violation of fundamental rights, and a decreased quality of life for the older person. Like it has been said, it can be physical, psychological, or emotional. It is also sometimes sexual exploitation, financial exploitation. It could be cultural, structural, and institutional, and can be an intentional neglect or unintentional neglect. The classification of elders' abuse is based on identified experiences of an older person, especially speaking from the Nigerian cultural background. What we have classified, as I've said before, of elders' abuse can be physical, psychological. But let me look at the rights of the elders or the elder person, particularly as we're looking at justice for them. The fundamental rights and individual liberty, especially the right to freedom from violence, constitute the most precious gift to a human being. Such rights and freedom have been subjected to violation, and there's need for their protection, as stated in the Universal Declaration of Human Rights in a Constitution, the 1999 Constitution of the Federal Republic of Nigeria. In December 1991, the United Nations adopted a set of principles for older persons, recommending that all member governments incorporate them into their programs for older people. These principles are based on the following Declaration of the Rights of Older Persons, which was summarized by the United Nations General Assembly as follows, quote, to add life to the years that have added to life, assuring all older persons independence, participation, care, self-fulfillment, and dignity. Coming down home to Nigeria and looking at our constitutional provisions in particular, under Chapter 2 of the 1999 Constitution as amended, that is the chapter containing the fundamental objectives and direct principles of state policy, and in particular, Section 14, subsection 2B, provides that, and I quote, the security and welfare of the people shall be the primary purpose of government. Also, Section 16 under the same chapter, subsection 2D, states that the state shall direct its policy towards ensuring that suitable and adequate shelter, suitable and adequate food, reasonable national minimum living wage, old age care, and pensions, and unemployment, sick benefits, and welfare of the disabled are provided for all citizens, unquote. And within this, we find for the aged or the old people. But unfortunately, these provisions are non-justiciable. We cannot go to court and press for these rights. However, some states in Nigeria, particularly I remember Ekiti State, some years ago, started a welfare package for elders, for old people. During the first term of Governor Fayemi, older persons were paid a monthly stipend of 5,000 naira. But how long and well this initiative has gone is unclear now, particularly with the economic reality on ground in Nigeria. The federal government some time ago also had a social welfare program wherein the poorest of the poor were handed some monthly cash stipends or some transfers into their accounts. How well and how good and sustainable this thing is I cannot say now. But the current challenges confronting the elderly in Nigeria includes, number one, social isolation. 2, perception of older people as physically and mentally unfit. 3, loneliness. 4, inability to adjust to life in retirement. 5, lack of meaningful activities. 6, homelessness. Thank God for some old people's homes in Nigeria now that are springing up, but children and family members are still skeptical and unwilling to take their old parents there because of social stigmatization. And number 7, limitation or inability to participate in community activities because they are weak, because they are sick, because there's no help for them. They can't do much. And I put it here, the way forward. What do we do? What can we do? Particularly within the context of the Constitution and our social services programs. The elderly persons in Nigeria need to have access to good health care. And I was happy when the Honorable Minister of State for Health reeled out some of the programs that are trying to bring up to include the old people. They need to have good health care and a good life. The Nigerian government in 2018 enacted the Senior Citizen Center Law after it was accepted to by President Muhammadu Buhari 2 years after it was passed by the House of Representatives.
Okay. I'm sorry to interrupt you. At this point, that is all we can take for now.
Okay.
Yes.
Can I quickly go on some suggestions? Hello?
Okay, just
Hello?
go ahead.
Can I just go through my suggestions?
Just do so in 1 minute, please. Just 1 minute.
Okay, I'm suggesting that there must be a concerted effort at formulating social security programs for the elderly. Many countries in Africa, Kenya, Mauritius, and our brother there just said it, are doing something that put some things in place for social security, particularly laws that are effective. In 2004, Pensions Reform Act in Nigeria, it provides an enabling legislation for the National Social Insurance Trust Fund to introduce a social insurance program for the unemployment benefits and the older people. But you see, the percentage of people that qualify for pension in Nigeria is very small compared to larger society where we have a good number of older persons. We need to develop a national policy on the elderly, and I call on the Minister of Humanitarian Affairs, Disaster Management and Social Development to quickly act in this regard. All of us will grow old one day and we need protection and an enabling environment to live a longer life and a better life will all go well for every one of us. I thank you very much for listening. Thank you.
Thank you so much. That was very enlightening, especially from the legal point of view. Thank you, Chief Mrs. Awumalo-San. It was a really—
Thank you very much.
Yes, and you took us through quite a lot. Of course, the older person has rights to freedom, rights to inclusion, and rights to be cared for at old age. And of course, the way forward is good health care and so on. But I would like to also say here that we now have a national policy for older persons. It is being used now. Yes. Okay. So that is one step ahead, one step forward.
Yes.
Okay.
Yes. Kudos
thank
to
you
Nigeria.
Yes, thank you so much. At this point, I want to go on to our next speaker, who is a physician with diverse wealth of clinical training and practice. Her clinical practice spans 3 countries, Nigeria, Kenya, and the United States. Dr. Osi Ogu has been head of the Department of Internal Medicine, Deputy Chair of Medical Advisory Committee, Acting Chair of Medical Advisory Committee at the National Hospital, Abuja. She is a fellow of the West African College of Physicians and currently Chief Consultant Physician and Geriatrician heading the Geriatrics Unit of the Department of Medicine, National Hospital, Abuja. She is also a member steering group of the Stakeholders Group on Aging, SGA Africa. Join me to welcome Dr. Ogugwa Osi Ogu. You have the mic, please.
Thank you very much, Architect Tonu. I would like to stand on existing protocol and to thank the leadership of Cosropin for this opportunity and for bringing to the fore this issue on aging. I will be talking about the about access to health as a human rights issue. Just as an introduction, the practice of medicine in its widest form adopted the Declaration of the World Health Organization. And really just to state that health is a state of complete physical and mental and social well-being and a fundamental human rights issue. Again, when we look at the physician to patient relationship, it also embodies what we expect in terms of dignity and respect. That respect should be given and equal treatment to all, regardless of age. So age not being a reason to deny care to anyone. We must maintain confidentiality, and in these days of electronic medical recording, we're able to do that. end-of-life issues, particularly as it concerns older adults. We tend to have these issues coming up in those who have end-stage heart failure, cancer that has spread to other parts of the body and limiting life. In discussing these issues, we again must maintain dignity and give autonomy to those older adults as they make decisions concerning their health. Communication, giving them the appropriate information for them to be able to make their decision on their own. We find that in this part of the world, younger adults feel that they know everything that should concern their older adults and actually make decisions that are not necessarily what the older adults have value for. Going to the theme of this year's World Elder Abuse Awareness Day, access to justice. UNDESA made a profound statement that violence, abuse, and neglect of older persons are the most hidden and underreported violations of human rights. Quite profound. And that access to justice includes right to health. So good healthcare, it's a human rights issue. And we all must have access to good healthcare, regardless of age. I'm going to give us a little intro on aging. I guess most of this we already know, but just to say that aging increases the risk for multi-morbidity. We've looked at our cohort of patients at the National Hospital, and almost 3 out of every 4 have at least 2 existing chronic medical conditions. And some of this we describe as the geriatric syndromes. And that, though multi-morbidity impacts on their quality of life and functional capacity, which are 2 critical elements when we look at older adults. There are gaps in our health systems where care is provided in silos. The same one older adult is seeing a cardiologist, seeing a nephrologist, maybe an orthopedic surgeon, and where there's no synergy between these experts. We might find unnecessary interventions. One person prescribes a drug that might react with the drug that is prescribed by the other person, unless there is a coordinating unit, which we tend to provide as geriatricians when these people have the opportunity to confront us. Our healthcare workforce are largely untrained to manage older adult issues. Again, a major gap in the healthcare system. So older adults need healthcare services that are aligned to their needs, meaning it should be acceptable to them, it should be available so they should not have to travel far, it should be affordable and of good quality. And where all of this are missing, that will constitute a violation of their rights to access health. So they do require care in different settings, in the homes, for those who are homebound, in the acute care settings in the hospital, for long-term care, palliative care. We need qualified, age-friendly healthcare workforce in all of these settings to be able to take care of their needs. Their health challenges range from physical to psychosocial, and of course we have the consequences of the multiple disease burden that would lead to frailty, where they are having to be dependent on their caregivers for all of their activities of daily living, the things you and I do, without even thinking about it. There are older adults who require assistance for basically every activity of daily living. There's also the risk of being institutionalized. I know that in our environment, we're still struggling with that. Some think, oh, we shouldn't put older adults in institutions, but there are those who really have this high disease burden and are at risk of abuse if they're left in the hands of their untrained, unskilled family members. So we need age-centered services and a healthcare workforce that is trained. What are the barriers to accessing healthcare in these older adults? The lack of health insurance coverage. In Nigeria today, you retire at 60, health insurance coverage drops. That is, again, another form of abuse, because your access to healthcare is diminished or limited just because of that act. Poverty, those who have competing issues for their meager funds would typically not, be thinking of going to a hospital when they have health issues. Lack of meaningful social support. If you have children who really don't have the time to take their older adults to the hospital when they need care, it reduces their access to healthcare. Remote living, which we know a lot of our older adults are rural dwellers. Where there's poor transportation system, they really won't be able to get to the hospitals where they need to access care. Lack of age-friendly healthcare facilities, where services are not integrated. Older adults are made to wait long hours to get to access care. Ageism, which in a nutshell is really having a discriminating mindset towards age, and that occurs both in the minds of the community and the older adults themselves. So that mindset needs to change. We've heard about the different types of elder abuse today, but I just want to give us another sub-classification, which is the organizational elder abuse. So where our health systems do not get aligned to the needs of these older adults, where our health systems are not age-friendly, it constitutes an abuse. Caregiver-related could be neglect for basic facilities like food, shelter, even their medications. It could be emotional, where language used towards older adults is so abusive. It's always strange when I see that, because we all plan to grow old, but then our activities do not show that we're actually respecting our older adults. Just to show us some of the global strategies that, again, are buttressing the fact that health is a human rights issue. The global strategy, an action plan on aging, one of the guiding principles for implementing the GSAP is human rights, and the strategic objective also just to emphasize the fact that health systems must be aligned to the needs of older adults. We must ensure a sustainable and appropriately trained, deployed, and managed healthcare workforce. That's a major gap that really needs to be worked on. Healthy aging also, emphasizes the fact that we want to maintain functional ability as people age across the life course. And for this functional ability, once it's maintained, the quality of life then is also maintained. And the benefits of that will be that there's quick recovery from illness because they have resilience, there's reduced risk of chronic diseases, we prevent falls, and there's increase in well-being and participation. Again, with the decade of healthy aging, we will be addressing 4 areas for action. And all of these areas, when we look at them, actually are saying, look, give access to healthcare as a human rights issue. We change how we think, feel, and act towards age and aging. We ensure that communities foster the abilities of older people. We deliver person-centered, integrated care and primary health services, responsive to older adults, and provide access to long-term care, including assistive devices and all of that. And there are major gaps in these issues. I mean, the mid-term report suggests that a lot of member states are not implementing these strategies for healthy aging. I would just like to end by bringing forward this WHO strategy, the integrated care for older people, which can be used at every community level. Our primary health care centers should be upgraded to be able to integrate care of older persons. Really very simple. You assess them for the common things that they tend to have: mobility limitations, depressive symptoms, cognition, hearing, vision, malnutrition. And once this can be done and identified early enough, they really can live a healthier life. So way forward, all stakeholders to promote the life course approach to healthy aging, older persons to be identified. We can get senior IDs so that we can identify what their health status stati are, what their needs are. These IDs can help them get social services, discounted airplane fares, discounted charges at supermarkets and all of that. We ensure that the universal health coverage is expanded to include older persons, and this would help us meet SDG 3. Provision of social services to alleviate poverty, training of healthcare workforce. Right now, we think we have about 50 million older adults in Nigeria, 60 and above, and less than a dozen geriatricians. Our nursing curriculum for physical therapists, all the other experts that we need for the MDT care of older adults do not include geriatrics. So again, a major gap that we need to work on. And that needs to happen for us to be able to align our health systems to the needs of these older adults. Palliative care, long-term care, major gaps that we still have in the country today. Our primary health care service facilities can house the senior citizen center activities where we have health promotive services, immunization for older adults. That's something, again, a major, major gap. Be able to give them an opportunity for skills acquisition, and that environment provides them the opportunity for that interaction, which could even involve intergenerational interactions as well.
Thank you,
okay,
Dr.
I guess, thank you very much for giving me this opportunity.
Thank you so much, so detailed. I guess our attendees would have to have a copy of this to get to know a lot more. I'm sure the paper is still remaining so much. Thank you so much for the time spent to prepare this. It's quite extensive. It's good to know that we need qualified aged care workforce, and there are gaps in age-centered services. That's why I personally own a nursing home. It's also good to know that we need to work on our health insurance coverage and poverty level, poverty index in the country, and then also look into the lack of social support. Ageism happens to be one of the major causes of elder abuse, and we need to look into that also. Thank you so much, Dr. Osioku, always making yourself available for service to humanity. Thank you, and God bless you. At this point, we want to take on our next speaker, who is from Togo. He is a professor of neurology in health science faculty of Lomé, and also head non-communicable disease division, neuroscience focal point for the Ministry of Health in Togo, focal point for World Dementia Observatory, and the president of the board of Special Olympics Togo. I make welcome Mufutau Bello to the mic. Thank you very much for being here.
Thank you for inviting me. Are you hearing me, please?
We can hear you, yes.
Okay. Honorable Ministers of State, Honorable Minister, Honorable President of Cosropin'S,
yeah.
Dear moderator, ladies and gentlemen, thank you for inviting me to speak about elderly rights in Togo, a French-speaking country. So you can apologize me for my poor English. This is the plan of my presentation. Okay. Today is June 15, the World Elder Abuse Awareness Day. Cosropin invited us to a web campaign to raise awareness in her community about elders abuse. According to World Health Organization, 1 in 10 elders people had been or is a victim of personal violence. To this, declared violence, which could be counted, must be added many hidden causes. Okay. This is not. This is a bad document. Let me go. Togo is a country located in West Africa. Like you know, our population is about 8 million. Togo is in majority Christianity, belong to ECOWAS, ACP. I have a problem. I have a problem. This is not the document. I'll go. Ay, ay, ay. Ay, ay. So, I have a lot of problem with my screen.
You want to reshadow him? Yeah. Okay, Prof. Can we take another speaker while you sort out your screen?
Okay.
All right.
Thank you. Thank you.
While you sort out your screen. Thank you very much.
Thank you.
At this point, we want to take Mr. Olayinka Ejumole from Nigeria. He is the Executive Director and Member Board of Trustees, Center on Aging, Department and Rights of Older Persons, CADRO, the National Coordinator, Nigerian Society of Geriatrics and Gerontology, NSGG, and Ambassador of Nigeria to the Commonwealth Association on Aging, Common Age. He recently became one of the few masters practitioners of Spark of Life philosophy after attending a training program in PIFS, SW Australia, through a scholarship from the Dementia Care Australia. He is a fellow of HELP, the Age Fellowship, Oxford Institute of Aging UK, and a member of the International Network for the Prevention of Elder Abuse. I know him as Mr. Elder Abuse. You have the floor, sir. Please speak to us. Take the mic as you speak to us. Thank you.
Thank you. Thank you very much, Architect Pastor Mrs. Ono. It's a great delight to be one of the speakers on a day like this. I'll stand on all existing protocols, and I'm so glad that the two representatives of the ministers have said a lot about elder abuse. But I will lay emphasis on it based on the issue of the day. The World Elder Abuse Awareness Day, like you said, is to create awareness. And I think it was a gap that was noticed and discovered some years ago. And to my dismay, the awareness level is still very low all over the world. But let's look at Africa and particularly Nigeria. I would want to assume that we should intensify efforts on creating awareness. I've discovered in my practice, especially in the southwest of Nigeria, that even the older persons themselves, they are not aware of their rights. So, and if you don't know your rights, even when you are abused, you don't know that you've been abused and you don't know how to seek redress. And so I always say that to start talking about abuse, we should talk about, do the elder persons themselves know their rights? And if they don't, how do we go about it? That's one. Then secondly, the society at large. A lot of people I know while working with victims are abused based on ignorance. some people don't even know acts that they perform on their older persons or older relatives are abuse, or rather they constitute abuse. So that's why I will say emphasis should usually be laid on creating awareness first. Then secondly, on the issue of access to justice. Justice comes with social inclusion. Justice, particularly for the older person, comes with, like one of the speakers said, access to adequate health care service. Justice for the older persons too in the society comes with issues of getting their pensions regularly, getting paid for whatever they did in the past. So we should look at access to justice from this point. And if we want to talk about the way they can access these facilities or services, which will make better quality life for them, we will now be finding solutions to problems of the older persons in our society. Then also, even when they are victims of abuse, how do they approach the law? Are the laws there adequately there to cover them? Thank God for now we have a national policy. It captured elder abuse in a very, a few paragraphs. The center has been created, and I know that the caliber of people there will come up with programs that will make the older persons know their rights and know how to seek redress. So approaching it from the law, I have examples of situations where people come to our center and they make us to know what is happening to them, or we have young people being abused. And we take these cases up, you get to the law enforcement agencies, and they try to convince you that there's no part of Nigerian law that is very specific about how to handle cases of elder abuse. And then the cultural side of it, they try to convince you to make it a problem of the family. Like they always say, go home and settle it. Is a problem of the family, because over the years, we've discovered that a large percentage of those who perpetrate abuse are close family members or relatives or even children. So when cases like that get to law enforcement agencies, all they will tell you is to go home and to go and settle it. That's their word. And then on the other side, most times you've noticed that they don't even want to report it. An older person who is perpetually abused in the family will not want to come to the open and express himself or herself on what he or she is experiencing. So these are areas that we got to lay emphasis on. Then even in the courts, will the person be willing to go to the extent of going to court to seek redress? These are areas. So what I would just say that talking about older persons and access to justice, trying to minimize the cases of elder abuse in our society, we need to intensify the issue of awareness, because you will be surprised if studies are carried out that even older persons themselves do not know that they have specific rights. And like I always say, they are not asking for more than necessary. They are only asking for their basic rights. And then situations where there are no places they can go to. That's why I want to advise that even the centers for senior citizens should be represented, or should be created in all states and local government areas, so that they can easily go in there and make reports on their experiences. Then cases where many of them have become victims, and there is no way they can get maybe some psychosocial counseling to try and make them, come out of the feeling they've had. I can cite an example of a woman who, in Ibadan, southwest Nigeria, who was locked in the boys' quarters. That's in the behind the house of the son. for many weeks until neighbors knew and reported to our agency that this woman has been ill-treated for so long because the son and the daughter-in-law, they believe that she's a witch or whatever. You know, and at the end of the day, when we set in with the police coming in to convince the man to, it was diagnosed in the university hospital that she was just passing through dementia. And there are many cases like that all over. So those of us who work closely with them have discovered that because there are no specific laws to address issues of elder abuse, it's very difficult for elderly people to access justice. Even when they, sometimes when they do, and they don't get it, well. Many people will say, "Well, you have spent your own time. Why don't you just take whatever you can get?" Making them subservient to the other group in the population. And all these have made the older persons to stay back and just take the crumbs from the table. Well, I will also talk about lack of knowledge of people who care for these people. One of the speakers has said it. We need to continually train people because caring for the older person is a specialized area. You cannot just push anybody to go and train to go and take care of an older person, because most of these people perpetrate abuse and put them in very deplorable condition because they themselves do not know the right things to do. So there are many challenges to working with the elderly people and making them access. But to the glory of God, faith-based organizations, particularly in the Southwest, have been very helpful. They collaborate with organizations like ours to see that those who have been abused, are rehabilitated in the society. And then secondly, of recent, some specific state governments have begun to make laws very specifically on your state. In the pipeline at the moment, there is a bill at the State Assembly called the Elderly Persons Protection Bill 2021. And we are quite hopeful that when this bill is eventually made a law, it will make us to do much more for the older persons in your state. And I'm sure that other states will follow suit. I know Lagos State at a point drafted something, but I'm not sure whether they are seeing the light of the day. So with all this, I just want to say that we should continually bring up programs that will make the older persons themselves know their rights and how to seek for justice, how to access what is theirs, particularly basic things. Thank you very much.
Thank you for maintaining the time slot. I really appreciate you. Like I said, you are organ of elder abuse, and you proved it with your practical solutions. Thank you so much. That was Mr. Olayinka Ejomole, who told us about intensifying and creating awareness of elder abuse, creating awareness of older persons' plight. And then also that a lot of people do not recognize the fact that dementia is real. So it presents itself and they don't recognize it. They're accused of all kinds of things. He also told us about lack of knowledge amongst the carers and the need for training. He also mentioned about state laws. Of course, some states have started doing something on laws concerning the older persons. We want to thank you at this point and for making yourself available to this cause. God bless you. I'll be taking our next speaker who had a problem with his mic, Professor Muftau Bello. Are you ready for us now? Hello? Prof, are you ready for us?
Yes, I'm ready now. Okay, good. This is my presentation plan. I showed you before. I was saying that today is the World AIDS Abuse Awareness Day. Cosropin invited me to speak about this problem in Togo. According to the World Health Organization, 1 of 10 eldest people had been or is a victim of personal violence. To this declared violence, which could be counted, must be hidden many hidden cases. In West Africa. So from where I am, I can join you in Nigeria within 2 hours and a half. Christianity is the majority religion in Togo. We have 8 million inhabitants in Togo. Like I said, Togo is one of the poorest countries in Africa. In Togo, the insufficiencies of the legal framework accentuates the vulnerability of the elderly and puts them in a difficult situation. Many elders people are often victims of abandonment, neglect, abuse of trust on the part of members or their own family on third parties. People are not courageous enough to denounce the acts of mistreatment of which they have been victims. World Health Organization defines abuse as consisting of a single or repeated act of the absence of appropriate intervention in a relationship that is supposed to be a relationship of trust, which results in injury or moral distress to the person. Old women who are often designed wicked because of dementia are frequently violated. This type of violence constitutes a violation of human rights and covers physical, sexual, psychological, or moral violence, material and financial violence, abandonment, neglect. The framework for implementation, the National Health Policy integrated the National Policy for the Protection of the Elderly in September 2010. And this November 3, 2020, the deputies voted unanimously to ratify the protocol to the African Charter on Human and People's Rights relating to the rights of the elderly, adopted in Addis Ababa in 2016, and the International Convention of the Protection of the Rights of Migrants, Workers, and Members of their Family, adopted in December 1990 in New York. Like you show, there's not a very legal protection of elders, but you can see in our constitution that there are articles protecting men, people, all peoples, and the elders are included inside this protection. Our strength and opportunity that our national health plan, which integrated elderly protection in some of the articles. There's the existence of social responsible for elderly health and social problems in the MOH and Ministry of Social Care. There's a good mapping of primary health. And one of our opportunities is that is the existing document elaborated in 2020 at the request of the WHO concerning elderly. What we suggest is to mobilize funds to do our second step survey, including the rights of the elder in some of our items. To conclude, in Togo, the insufficiency to the legal framework accentuates the vulnerability of the elderly and puts them in a difficult situation. Thank you so much.
Oh, thank you for that very brief expose and very detailed. It's good to know that as small as Togo is, they've really done some advancements in aging, and that they have elderly protection embedded in their constitution. It's also good to know that they have existing structures responsible for older persons and for solving social problems. And for my own country, this is not really in place. We're just trying, and we are just at the verge of acquiring most of these things. So even though you said they were the poorest country in Africa, they seem to have been advancing so much in aging, and kudos to Togo. Thank you so much, Professor Muftal, for your availability to humanity. Thank you so much. God bless you. At this point, I would like to take on our next speaker, who is from Kenya. He is my colleague as far as institutional care is concerned for the older persons. He owns SJ Remedial Care Center, Kenya, and promotes healthy aging in Kenya. Join me as I welcome to the mic, Mr. James M. Munisia. You're welcome. Could you go on to the mic now, sir? Thank you so much for being here. The mic is for you.
Thank you, everyone. I think I'll go straight to the major points. I see we have very limited time here, but I'm pleased to be part of this. And I must say thank you to the ministers and all protocols here. Talking about elder abuse is quite a very disturbing issue in 21st century. But we know we are in that world country. We are in that world, most of us. We have First World who are still fighting the vice. So let's see how the experiences are here in Kenya, particularly. Elder abuse is in Kenya. This presentation is from an allied health professional. I run SJ Remedial Care Homes, and I'm a medical director. The demographics in Kenya. Kenya has about 1.2 million people over 65s. In a population of that 8.6 million, representing 3.8% of the total population. But we have more men than women. This is the standard population distribution by age 2020 and sex. What are the current risk factors for the elder abuse? Caregiver depression. When I say, because generally if an elder person is abused, are they able to get justice? My view is it starts with us, it goes to the caregiver, it goes to the village, it goes to the state, and then the whole world. But a caregiver, if a caregiver is depressed, that's the beginning of injustice. So we must protect the caregivers. And no recognition of incentives for professional carers by the government in Kenya. You find most of these informal caregivers, they are not, that is family caregivers, they are not recognized. We don't have their councils which remunerate them, and they inspect them like the way we have doctors, we have nurses, which is also quite a limiting factor to say that our elders will ever get justice. Lack of financial support and potential caregiver for potential caregivers. Some of us,
vous diminuez. Vous diminuez.
Pardon?
Vous prenez un matin, un soir. Et puis après, progressivement, on va monter.
Pardon? Lack of financial support for potential caregivers. Some of us, we call ourselves caregivers, but we don't even get incentives from the government or any institution. So we end up exhausting our pockets most of the times. So it's very hard to get in justice when you are undergoing such indicators. Substance abuse by the caregiver. You find caregivers who abuse the elder because maybe they came to work when they have abused. Maybe they are using other drugs. So it's something that we need to look at. Perception by caregiver that taking care of an elder is burdensome and without emotional reward. It's quite a big task, but most of our caregivers, they still have the minimum wage. Intensify of care need and illness or the dementia. So if you have high intensity of care, you find there is a burden in the care system, whether it's a family, whether it's an institution. So this is a vulnerability of an abuse. And is this person going to get justice? That's my worry. Witchcraft and other myths and misconceptions. We have now the SARS-CoV-2 pandemic measures, which really is promoting loneliness, isolation. So all these things can culminate in abuse, and thus there's no justice there. Corruption due to top-down approach in elder support program and implementation. You find there is top-down approach in the government level or ministries level. So they don't engage grassroots people. They don't engage. So you find by the time maybe funds get to the grassroots level, you find the pockets are empty. Sorry. What about witchcraft allegation? As my previous speaker have said, witchcraft is one of the things that have culminated to most of our elders who suffer from generally dementia or who are living with dementia. Witchcraft is a practice of what practitioner, the witch, believe that they have supernatural skill, abilities to perform magical rituals. Witchcraft remains illegal in Kenya. In Kenya, 120 elderly people are killed every year on suspicion of witchcraft, according to the police statistics 2018 research study. The young person are murdering elderly relatives, especially those living with dementia, claiming they are witches, but it is because of wealth. In the wake of this, large disputes have increased, whereby elders feel the youth are using shortcuts to own and sell. This leaves the elder person in an awkward situation, abused and even killed. So there again, you find this is a person who cannot even be able maybe to seek justice. Dementia stigma and lack of awareness is a major cause of abuse, especially in Western Kenya. Persons living with dementia have dementia-related behavioral changes. In a recent case, an elderly was beaten up in a mall just because she claimed she owned it. In Central Kenya, most people believe someone living with dementia is a curse or did something wrong to someone and was bewitched. Let's look at the SARS-CoV-2 measures. COVID-19 pandemic measures enacted by the Center for Disease Control of Social Physical Distancing left all elders isolated, a well-known risk factor for elder abuse. Secondly, flop in stock market left elders vulnerable to financial abuse and scams due to financial instabilities and rush to salvage. What is the government doing? Currently, there is a registration process which has been going on 2020-21 due to COVID-19. You find COVID-19 has exposed increase in elder abuse in Kenya. The government has promoted and secured the right of older persons by enacting policies that provides an environment that recognizes, empowers, and facilitates their welfare. Also expediting of Older Persons Care and Protection Bill 2018 in Kenya, which has taken too long anyway. Secondly, we have the financial support. Older Persons Cash Transfer Program started in 2007 with every enlisted house of persons over 65 years entitled to about $20 per month with a stipend emergency support during COVID-19 pandemic period.
1 minute more.
Pardon?
1 minute more.
Sure, thank you. What is the community doing? Supporting care centers and volunteering. Community-based organizations are set to evaluate community-level abuses, liaising with professionals and promote health in the elderly, church leaders, home visits, and basic needs and spiritual support. Media awareness, participation, especially in social media. Just to go to the conclusion, we have fast aging population in sub-Saharan Africa and in Africa as a whole. The projection indicate three or fourfold elder increase by 2050. So tracking on pillars deterrent to elder abuse is key. What is the government doing? What they are supposed to do or what they intend to do is enact a fine-tuned supporting program that protect, identify, intervene, and punish perpetrators to enhance justice to older persons. Thank you very much.
Thank you, Dr. James. It was a nice one coming from Kenya.
Thank you.
There are some things that resonated with me. Funny enough, it has nothing to do with elder abuse. You said there are more men than women. You can come to Nigeria and collect some women. I'm sure we have more women than men here. So the caregiver depression is definitely something that we really need to talk about more. And you can see that we need respite care. Nobody is talking about respite care. Those things, they help. Then there's something you said again about the ministries do not engage grassroots, you know. They do not engage the grassroots. I think this is very common in African countries. The fact of witchcraft being something that is very strong is also very prevalent in Nigeria here. But it's shocking to know that you have statistics that not less than 20 people are killed every year. That's very sad. I like your solutions. I guess we'll still revisit as when we're more settled. Thank you so much for this extensive work, Dr. James. Thank you.
Thank you.
At this point, I want us to go on a 1 minute break and let everybody put on their pictures because we want to take a screenshot of those that are here present. Just a second, please. Can everybody just put on their videos so that we can have pictures of everyone here? It's either you have your videos or you have your pictures on, so we can take a screenshot. And while we are doing this, I would like Onibe to be on standby. She's going to be our next speaker. She'll be on. While they do that, the next speaker can go on. We'll take. She is a medical doctor who graduated from College of Medicine, University of Lagos in 1975. She is a senior citizen herself. She's a professor of medicine and was a consultant physician neurologist until her retirement in September 2020. She is the founder, Moonshine Elder Care Center in Benin City, Nigeria, providing daycare, recreational activities, short-term and long-term stay for older persons with or without challenges. I want to make welcome at this point Professor Evelyn Onuide, who is also a member of Cosropin'S, to the mic.
Very much. I hope my slide is being seen.
Yes, your slide is here.
Fine. Just a point of correction. I'm a nephrologist, not a neurologist. Before Dr. Bello from Togo thinks I'm coming to his area. Now, the time is very short, so please excuse me and let me stand on existing protocol.
All right.
Elder abuse, a lot of people have talked about it, but I won't spend too much except to stress that whatever definition you take, elder abuse causes harm to an older person. It's usually carried out by someone that the elder trusts, e.g. a family member, a friend, or a caregiver. It's a global problem, like we have heard, and it affects human rights, well-being of the elders. Prevalence is very high, but underreported, and we have been told the different types of elder abuse. Now, Architect Olu approached me and said I should talk about elder abuse as a carer because I run an elder care home. But she also said I should talk about my personal experience because I'm an elder. So I will start with that. And I will just give a few examples. I believe in practical talk. I'll give practical examples and we can pick out the elder abuse that happened in them. I was made chair of a committee in my professional association where I worked until last year, and we set up criteria for a position that was being advertised. So we know those that qualify. And my committee worked very hard and came up with recommendations, and we reported back to the body. And the next thing I got ahead was that, oh, a young man got up and said, the recommendations are archaic. And that came from a former student, somebody that I had taught in medical school. And he thought because I was now an older person, my ideas didn't matter. That wasn't what happened in the traditional setting that we were used to when we were growing up. Second example I have experienced is that I went into a bank. I wanted to use the ATM, but the ATM machines were not dispensing money. And so let me get into the banking hall and use their POS. I got in and met a long queue, and I approached the lady who was in charge. This is my problem. He said, okay, no problem. I will attend to you when I finish with this present one. And when she started attending to me, there was an uproar behind me. Young adults started protesting. Why will you attend to her? Let her go to the back. I was bewildered and taken aback. Respect for elder completely went on the ground. Now, I retired last year in September at the age of 70. And 9 months thereafter, I've not received a penny of my pension. That is not so painful. As a colleague, another professor of medicine who retired in April 2020, and that is more than 1 year, he died last month without receiving a dime of his pension. The examples are given are examples of emotional, psychological, and financial abuse, and they are very practical and they exist in our everyday life. Now, my experience of elder abuse as a carer, I have divided it up into 3 categories. We have elder abuse by family members, elder abuse by caregivers in elder care facilities, and then abuse of caregivers by clients and relations of clients. Let me just dispose of this third example because it's not truly elder abuse, but it's worth mentioning. I have had occasions in my elder care center where a client slapped a caregiver for no just cause. So that is an elder abusing a younger person. And we have relations who have come into the center screaming, protesting for no reason, cursing, and doing all kinds, even threatening to take us to go put us in prison for offense that we didn't commit. Like I said, I'm just bringing that up so we know that even carers are also being abused. Now, what abuse by family members? Elder abuse by family members. I have listed them here: neglect, abandonment, financial abuse, psychological, emotional abuse. These are the ones I have encountered in my center. I have not encountered physical abuse, sexual abuse so far, and I thank God for that. And I just give you a few examples of these different types of abuse. For neglect and abandonment, these are true situations, real situations. I had an 87-year-old man come into my center. Prior to this, he had had a stroke in his house. He was left at home, he developed bed sores. Somehow the son who lives far away from him came and took him to hospital. He got better and was discharged, but no one was ready to take him home until they brought him to my center. Remember, he lived with his wife in his house. The wife was there and abandoned him with a stroke and his bed sores. And he stayed in my center for 6 months. He loved his wife so much, wanted to go back home. And we couldn't stop him, so we went back home. But he passed on 4 weeks later. We can imagine what happened to him. The neglect, the abandonment continued. I have had another story of, again, another 87-year-old woman who has 6 children, 2 males and 4 females. The 2 males live abroad, the 4 females live in the same town with her. And the males send money to their sisters to look after their mother. Unfortunately, the woman lives alone. So what these doctors do, they buy what we call Santana, some cassava meal that I'm sure a lot of us know about, and soup that will last Mama for 4 to 5 days. Mama lives alone, so Mama is not able to warm the soup. And so the soup and the Santana get bad and develop mold on her. And this continued over a long period until one of the sons came and saw the situation of abandonment and neglect and brought her to my center. Psychological, emotional abuse is very, very common. Before the financial abuse, I have a good example of a lady, another retired teacher. And from time to time, the children will come and take her, we're taking her for screening. Like they say in my state, Edo State, I'm a live screening. So they took her, but we never really saw evidence of this money being paid to her every month. They were not ready to take her to hospital for regular checkups. They were not paying her bills on time. She had no phone. And this was a lady, pretty lady, 60-something, who was earning pension money every month. And we wondered, where did this money go to? I don't know. Psychological abuse or emotional abuse, I have a lady in my house, my center, who has 2 children. One lives far away, so she can't come. But this lady has been in my center for over a year. That daughter has only come once. The son who lives in town doesn't come. He comes like once in 3 months, or sometimes more than 3 months. And anytime you can see the glow in the eyes, in the face of this lady, because she's happy seeing the son. Unfortunately, he doesn't come. She's being emotionally abused. Like I said, we haven't had physical or sexual abuse. Now, these are the elder abuse I have noticed from family members in clients I've had in my facility. Now, we have abuse by caregivers. I won't run away from that. It is true, caregivers do abuse elders. And what I've noticed in my center is, 1, neglect. You see a caregiver refusing to promptly attend to a client who needs attention. For clients who are physically handicapped, they're on a wheelchair. Like I have one in my center who has bilateral below-knee amputation, is on a wheelchair, so he cannot move. And so he has to ring a bell for attention. And when he rings the bell, I notice that some of the caregivers don't want to go and see what is going on with him. And if they do, they really are not very keen because maybe he has messed up himself or the other. So neglect by caregivers is something that even goes on in elder care facilities. We have emotional abuse of elders in elder care facilities. Some caregivers just subtly refuse to attend to some clients. Like I said, clients who are on wheelchairs, clients who often mess up themselves. I notice some of them just sit back. They won't want to unless you have to push them to do it.
Sorry to cut Sorry
Yes.
to cut you. Just 2 seconds more, please.
Oh, okay. So we have financial abuse too, and clients, caregivers taking money from clients. Now, what's the way forward? We need to have efforts to make programs to increase awareness of elder abuse at community, state, and national levels, and older persons and need to be aware of their rights. And we need to, the care of older people should not be left to families alone. Legislation needs to be put in place to restore society respect for elders, e.g. priority at public places. And in conclusion, it is prevalent, so it's a problem we should think about. Like I tell the younger ones, caring for older persons is payback time for someone who cared for you earlier in life. So create situations. And let me leave you with the word of God. Exodus 20:12 says, honor your father and your mother, that your days may be long upon the land that your Lord has given you. And Ephesians 6:2-3 says, honor your father and your mother, which is the first commandment with promise, that it may be well with you and you may live long on earth. So we are fulfilling God's words to us by honoring. And honoring your mother and your father, it's not just your biological mother and father, it's that elder on the street. That is your mother and your father. We begin to begin to honor them. Thank you very much.
Thank you so much, Prof. Thank you for the time it took you to put this together. Thank you so much. Our time is fast spent and we still have 2 other speakers left. At this point, I want to call on next speaker, Mary Ikopu, who is a media and communication consultant, a human rights advocate, gender development expert. She is the executive director of Emerge Women's Development Initiative. I invite her to take the mic at this time. I hope she is on. So can Mary Ikoku please take the mic quickly and
okay. Thank you, Architect Ono, and thank you, Honorable Minister, the previous speakers. This is quite an interesting conversation, and I'm very happy that it is happening now. When it should have happened, 20 years ago, but I'm just happy that the best other time to do that is right now. I'm not sure if, I've listened to most of the conversations that have gone on from the ministers to my fellow panelists, and it's quite an interesting one. I'm not sure if any one of us here have heard someone being trailed for abusing an elderly person. You know, the way you see armed robbers being hung, being criminalized and all of that. Have you seen someone being trailed or being really punished for dealing with an elderly person? Oftentimes, it is a subject matter that we all put under the culture of silence also. And when you look at access to justice to this group of people who obviously fall into the vulnerable group, you will agree with me, just like most of the speakers have said, that they go through a lot of abuses, ranging from financial, emotional, psychological, physical, just like everybody else have said. But for me, I would like to look at what Cosropin'S, right, is doing, this organization. And I want to thank every member of this group, of this association. What you're doing is timely. And I am very happy to say that, you know, one of the things that we need to have in mind is that elder abuse is a silent problem that robs senior citizens of their dignity, their security, and in some cases, cost them their lives. So oftentimes we say we're going for funeral, is the grandmother or grandfather. How many years is the next thing you ask the person? It doesn't matter how many years. People can live for 120 and still live well and good and happy. But you don't need to shorten their lifetime for them. And of course, you will go to hell if you do that, and you're listening to me right now. We have, and I'm just glad that Cosropin'S is working towards advance elders' rights in Nigeria. I'm also glad that they are advancing the legislation that funds the Senior Citizens Act, which I remember was sponsored by my very good friend and sister, Honorable Nkiru Uka Onyejocha, the current Deputy Chief Whip of this ninth Assembly in the House of Representatives, is a fantastic bill which has been assented by the President, which makes it a law now in Nigeria, that you cannot treat senior citizens anyhow. And I want us to look at the issue of senior citizens. Some of us, people think, okay, somebody turns 40, he turned 50, and you see people, especially women, you just go do photo shoot and show off your beauty. But internally, you're dealing with pain, weak bones, and all these arthritic pains, which are all covered up in our makeup. People need to start thinking about aging right from when you are 40. It is not till you get to 60, till you get to 70, you start early, because what you plant at the early hours of your aging is very important. I remember the year I turned 40. My friend called me, a man, and he said to me, Mrs. Ikoku, the only gift I can give you now is take good care of yourself. Take good care of your health. If it's the only thing you do now, start doing that. And that was quite instructive, because over the years, I began to see a lot of changes in your body. Forget makeup, forget Mary Kay, forget all of those things. Aging starts quite when you don't talk about them. So I am so happy that this conversation is going on now. It is timely. And I need us to understand that the degree of civilization of every country reflects her justice system and vice versa. So the poor system of justice in Nigeria is obviously going to be reflected on the level of our civilization and development. And you will see it. I'm happy the legal persons are talking about the right, the justice, the access to justice that are in place, the bills that have been passed. But on to what level of implementation are we dealing with? There's so many international charters on elders abuse. Nigeria will go out there, sign it, be part of it. Domestication becomes a problem, just the way implementation of our local laws are a problem. So we all have to own this responsibility and say, this is our struggle, this is our responsibility to make sure that that older person in your environment, in your community, that you give a helping hand. I cannot speak this just by saying or mouthing it. In 2009, I met Architect Victoria. In fact, both of us were guests. I think we debated this matter on a live radio show. Petra anchored that show. I don't know where Petra is now. You know? So it took my mind back to that day. And I was on that radio program very, very viciously canvassing for community taking care of their elderly. That I was very much against old people's home or nursing home, as you would like. And Architect Onu was busy trying to win me over, trying to get me. It took me, I think, two years down the line to now care for my aged mother-in-law who was ailing in health, to understand the proposition of Architect Onu. It took you experiencing what elders go through to have an understanding of what all of us need to do, right? So I think after 1 year, I called her and I really did apologize. That I said, I've been converted, now I know. There are so many things elders go through. I had sent my slide. I don't know for what reason, whether they received it or not, but I can just talk through it. I always do. First and foremost, we need to understand that Africa is not homogeneous. So I will not argue from the African perspective, but I will use Nigeria as a case study. And that's me. We can drive similarities like we've done from the person from Kenya and all that with other African countries. But studies have revealed that Nigeria has no functional national policy. I just heard it today that we do have. But if we do have that, and it hasn't been effectively communicated to the citizenry and those who would need to know that that policy is in place, do you really have that policy in place? Is my question. So we all have to begin to really think responsibly on how we can own this issue and begin to do the do. Yeah? And then there's also the state and neoliberalism that the advent of it, we all know how the social sector broke and reduced the government's ability to provide social services. We cannot wish away that whole government-owned companies and liberalize the market so that the market controls the price and the consumer now are not able to give services effectively like that. So it was also driven by competition and targets, meaning that there are many reasons to ostracize the older people from the workforce and the state that cater to the welfare of the people. Therefore, there is a need to create a protection system that caters for the elder financially and their health. Because neoliberalism, what it does is that it chooses where they want services. Companies services. And if you don't get to the root of the problem, you won't understand it, because before now, everybody understands that you have to take care of your old one. But the Generation Z is not thinking like that. This is a generation that is not ready, that are not thinking of marriage. They're not thinking about, you hear about baby mama, baby daddy. This generation, we need to watch out carefully. They don't have a lot of difficulties. Things that were difficult for us are very simplified. What we called hard work, they've called their own soft work. So we need to pay attention. These soft work people, are they ready and willing to take care of their elderly? And that brings us to why we need older people's home or care locations and hospitals and nursing homes where our older people can be cared for. And that is when they are ailing in health, because your family members are not trained in geriatric cases. They don't know how to. And sometimes my own experience with my mother-in-law, I thank God I was able to give her the best care, my husband and I, but it cost us a lot. It costs you your emotions, it costs you your health, it costs you, because all you want is to make her enjoy the last part of her life, right? But you are not trained to give that kind of care, but we learned. But a lot of families who are poor, how are they able to even house that? Imagine an older senior citizen was once earning 15 digits, and now suddenly you bring him into a younger person's home that is a 2-bedroom flat. How do you, her emotion is already beginning to dwindle. This is not the life she or he wants for herself. So I would think that, I think I have 7 minutes. We need to look around ourselves, and we need to look at, there was a picture I put and say, what comes to your mind? It was a hand holding money, and it's the elderly person holding the money, and the other person holding her hand. The exploitation that old people go through in this country is unbelievable. It sends you to go and buy something for them. You come, you don't give them change. You think because some of them are retrogressing mentally, you don't return their change. They don't report these cases because they also want company. So they don't want to send away, report the person that is there for them so that you don't stay away. They want company. Then sexual assault. When an elderly is assaulted, we speak about it in hush-hush tone. I don't even see my colleagues in the civil society tying their wrapper on the waist to say we are going to fight for an 80-year-old that was raped. A lot of things need to change, because every one of us will get to be old one day. And I would end by saying one last thing. I remember during the week leading to my mother-in-law's death, I remember she tried she tried to just go without disturbing anybody, right? So a day before she passed, I remember coming into her room, because from time to time they need company. I go into her room, sit by her bedside, and gist will start. You know one thing she said that day, she said, Mary, I want to tell you something. Because you took care of me, somebody will take care of you. I had no idea where that was coming from, but she made sure that everybody that cared for her, my first son, her physiotherapist, Chidima, that comes to the house every three times a week, her cardiologist, all of those people did say after she passed that she said this same word to them. So my final word is, look, your old person, your elderly is not a witch. The churches need to hear this. All of these mushroom churches that tag our elderly parents witches are churches that CAC needs to be clamping down and closing down on. It is evil. It is wicked. It is unbelievable how a witch could raise your daughter and son till adulthood. She didn't take your life. But one mushroom chop comes up and tags your mother, your father, your elderly, a witch. It's not on. Let us all tell ourselves the truth. These things are happening. That's why I want to situate my own to Nigeria, and not because Africa is not homogeneous. I couldn't share my screen. I don't know why it wasn't shared, but I am just, this is me, passion driven. I just want to see a just world for everybody, be it elderly, be it a woman, be it a person living with disability. It is very important that we take care of ourselves, everybody. Thank you very much.
Thank you so much, Mary Ikoku. We thank you so much for making yourself available. That was very passionate. That was very direct. That was very practical. Thank you so much. You brought light to this place. God bless you. At this point, we would like to take, we have two more speakers. I want to just plead with them, if it's possible to really make it brief, if it's possible to just go to solutions. But if not, please just do what you have to do. And I'm sure we'll finish in the next 10 minutes. Can we have at this point our presenter from South Africa? She studied on understanding and preventing dementia at the University of Tasmania. Her humanitarian work started in Nigeria during her 2-year stay here. She belongs to many dementia support groups around the world and has been weekly on radio interviews in the UK regarding dementia. Please, let's make welcome Pearl Kandara Modley. She is more Nigerian than she is South African. You're welcome to the mic, please. Hello, can we have Pearl on the mic, please?
Honorable, thank you so much. Honorable Minister, the President of Cosropin, the previous speakers, ladies and gentlemen from Nigeria, all over Africa and the rest of the world, thank you for giving me this opportunity. And yes, Nigeria does own me. I would regard it as home. The concern about elderly abuse increases as the global population ages. Elder abuse is a global public health, human rights, and criminal justice problem that goes beyond social economic classes and region. It still remains. Can you hear me now? Can you hear me now?
We can hear you. We can hear you.
Just go on, please.
Can you hear me now?
Hear you.
Yes. Yes, we can hear you.
Oh, thank you. The concern about elderly abuse increases as the global population ages. Elder abuse is a global public health, human rights, and criminal justice problem that goes beyond social economic classes and regions. It still remains understudied, especially in developing countries with limited resources. And I think that's the problem that we actually have in Africa and all around. It is therefore timely to do a review of the available research on elder abuse in South Africa. The available research on elder abuse is very limited, and there's no reliable data about the prevalence of elder abuse in South Africa could be found, unfortunately. The definition offered by Action of Elder Abuse in the United Kingdom and World Health Organization A single or repeated act or lack of appropriate action occurring with any relationship where there is an expectation of trust cause harm or distress to an older person. Initial definitions were considered overly broad. However, consensus have risen about the inclusion of 5 major types of elder abuse: physical, psychological, or verbal, sexual, financial exploitation. The main risk factors to become a victim of abuse are being female. The presence of cognitive impairment and being older than 74 years. We have one case study in South Africa that I'd like to mention. In the Mafeking study, factors that were associated with elder abuse, including having no working children, being single, or living in an elderly family couple with family, living in rural areas, having a poor self-perception of health, and having a disability. Old age is easier for some groups in South Africa's population, example, the whites, but more research is needed into the prevalence of risk factors for the abuse in specific groups, example, the blacks. Cultural, political, economic bans, social realities, together with negative social attitudes towards older persons. The vulnerability of the elder to poverty, abuse, and violations of their human rights. Older persons should be informed about their rights and how to access support services. Community members, health professionals should be aware of reporting requirements and the processes to the following. Awareness campaigns can be done in forms of community workshops and media campaigns, while government involvement should be encouraged. Elder abuse occurs in every country, and governments have a very important role to play in the care and protection of older citizens, and should implement strategies that will allow a person to age with security and dignity. They should include early recognition of elder abuse, effective reporting processes, adequately trained professionals, and suitable care facilities. The problems, allegations of witchcraft, mainly against elderly Black women, and as a result of the accusation of their properties can be confiscated and they can be assaulted or even burnt. Another concerning tendency is particularly violent forms of abuse, especially rape of older women by sons or grandsons to extort pension money. These acts tend to be concealed and are often not seen as rape in communities. And the abuse is perpetrated within the family. I'd just like to end. I don't know how much of more time I have. Can I still go on?
No, please. Thank you. Thank you.
Hello?
Yeah. Just conclude. Just conclude.
Can I still go on?
Just conclude.
Okay. Awareness campaign should. Okay. Awareness campaign should be done in forms of community workshops and media campaigns, while the government involvement should be encouraged. And I think that is so important, because now this is where the government is needed in most. You know, elder abuse, dementia, any mental cognitive impairments on people have been so neglected. You know, it was never made a concern, but actually it should be made a concern. And thank you to this organization by bringing this into light, where the government should, you know, now take a turn and make it easier. Opportunities should be created for older persons to participate in their societies and to alleviate poverty and its associated negative consequences of ill health and abuse. There should be coordinated efforts at the national level to preserve and protect human rights of the vulnerable aging population and to prevent elder abuse in any forms. Esheo, I thank you from South Africa.
Thank you very much, Eshego. We have a few comments on your speech, your talk. Somebody here is saying, thank you so very much for this meeting. So excited, enlightening, so excited to hear about the elders in other African countries. I wish to support Mr. Jumole's suggestion for public enlightenment. This will achieve much and sensitize all to their statutory responsibility. Another said, thank you so much for this meeting. So enlightening, so exciting to hear about older elders in other African countries. I wish to support. I think that's a repetition. Then we have awareness campaign is very important. As we continue, I may not be able to reiterate what you said, but thank you so much, Modley. You've been awesome. Thank you, Eshegon. I will be quickly moving on to Ghana. The train is taking us to Ghana, and we're going to take on Paul Teiko Tagwe. You know, he is the national convener of the Coalition for the Rights of Older Persons, GOROP, Ghana, where he is responsible for mobilizing stakeholders and building partnerships to sustain social services and advocacy for the possible for a possible UN Convention for the Rights of Older Persons. Over the years, Paul Teiko Tagwe has been engaged in regional expert meetings convened by Global Alliance on the Rights of Older Persons, GOROP, and the Center for Human Rights Studies, University of Pretoria, South Africa. You're very welcome, Paul. Please, can you handle the mic? Thank you.
Okay, thank you very much. Honorable Ministers of State, ably represented by Dr. Imamu Makaru, and Minister of State for Health in Nigeria, ably represented by Madame Eneke, President of the Coalition for Societies for Rights of Older People in Nigeria, Senator Dr. Eze Ajoko, Architect Victoria Onu, distinguished moderator, fellow discussants, ladies and gentlemen. I will be presenting my program or my topic. I want to share some screens with you. Hello.
Please go on, we can hear you.
Okay, so I'm doing a presentation on the justice system and its involvement in addressing elder abuse in Ghana. Three major
We have a problem with your network. We have a problem with your network. Oh no. Hello. Okay. Yes, that was supposed to be our last speaker. He has a problem with his network. At this point, I want to call on the president of the Coalition of Societies for the Rights of Older Persons, Cosropin, our own very own Senator Eze Ajoko, to please address us briefly as we go on to close.
Well, I want to thank everybody. This is very exciting, like I said at the beginning, and it's been, you know, very educational, and I'm sure we have all gained a lot. We will try and summarize all that was said, and we'll try and make it available to people. But allow me to recognize our Secretary General, May Ikoku, and our legal advisor, Zakios Sebanjo, who have joined us from the United States, where they have been for a long time. Thank you for joining us. Let me say that a lot has been said about a lot has been said, and I just want to mention that in Nigeria, we're making progress. Amen. We have a bill encapsulates many of the issues that have been raised in the area of elder abuse. And we are confident that when that bill is finally passed and signed off, it will address a lot of issues. Of course, you all know that aging now is on the front burner in Nigeria because of the activities of all stakeholders, especially the Coalition of Societies for the Right of Older Persons in Nigeria. And we are glad that, you know, the Senior Citizen Center, which we've been fighting for the establishment, has finally, and we are proud that 2 of our own members are on that board, and one of them is the Director General who represented the minister. So we are making progress, and we're glad at what is happening. We are also happy that we've gotten at least, like Ajimole said, the national policy on aging, which will now have a lot to do to create awareness so that older persons will begin to know their rights and privileges. You know, when you know your right, you can claim it. Now, we are discussing the issues of elder abuse today. And I want to say for us, it's a 1-month activity. Many of our member organizations have programs lined up for the rest of the month on it. This week, particularly Cosropin from the headquarters, we have other activities. On Thursday of this week, at the same time, 12 o'clock, we are trying to hold our ministries, departments, and agencies accountable. So we have a national webinar. We have a national webinar on Thursday, and it will be calling all the ministries and departments to tell us what they are doing in the fight against elder abuse. Many of the ministers will be on that platform. On Thursday, we invite you to tune in. And on Saturday, we are going to have a novelty match at 3 p.m. at the old parade ground towards the first national, where we are trying to also encourage leisure in addition to our center, which will provide interaction for older persons. We are trying to make sure that older persons can engage in sports in order to enhance their participation and involvement in intergenerational and social activities. So Saturday, there will be a match at 3 p.m. To ensure that older persons are made to feel happy, excited, and bubbling with life. Just as one of our organizations, the Graceful Aging Fellowship, organizes healthy aging exercise every Saturday for older persons. So in Nigeria, we're doing a lot, and we're happy that government is hearing us. Every member of Cosropin in their own rights are doing a lot to ensure, especially now that in the last 4 years, we have brought aging to the forefront and the front burner. I want to use this opportunity to thank all our people. We would want to know if the person from Ghana, he has fixed his...
Sure.
All right, can we have you for the next 5 minutes maximum?
Okay.
After that, May Ikoku from the United States, who is our Secretary General, will make the vote of thanks.
Okay, thank you very much, Senator, for the opportunity. I think the internet has not been friendly with me at all. So we're talking about the forms of abuse at the community level, where people think that some of these issues borders on issues of witchcraft. So they perpetrate all forms of abuse against the elders, mostly of low socio-economic status and background. And these forms of abuses consist of neglect, forcible confinement, compelling the elderly to isolate themselves in shrines and witches' camp, which is very popular in the northern part of Ghana. And at these camps and at the community level, the older persons are subject to all forms of torture and even murder. And we have the celebrated case of the late Madame Ikriadente, a 90-year-old woman who was accused of witchcraft and murdered in a broad daylight in a village in Kafaba in the Savannah region of Ghana. This unfortunate incident took place in Ghana with widespread condemnation from even the president of Ghana and investigations were duly launched into finding the culprits. The issues are before the law courts of Ghana. So what are the motivational factors? I think previous speakers have been able to touch on this, but I'll quickly run through you. Well, people think that the reason for beating up these old women is because they are being suspected for the death of their family members or community members. Others think that because of financial or economic hardship, these women are very much aware, or the older people are part of the reasons for the economic predicaments. Of course, witchcraft allegations are also being forwarded by traditional spiritualists, pastors, and these end-time prophets who, claim all sorts of things against the older women for bewitching the younger generations. Of course, there are issues of reporting challenges where people think that the issues of abuse are private matters which should be discussed or addressed outside our justice system. So these are some of the things that is fueling or instigating elder abuse. So what is Ghana doing about fighting or addressing the elder abuse in our system? Of course, Ghana is a signatory to international treaties and charters. And so by this, we are mandated by institutions, which is a collection of rules, standard operating procedures, and structures to make sure that the rights of people are well respected, including the rights of our older people. So we have in our constitution, that is the fundamental law of the land, the fundamental freedoms of human rights and freedoms are enshrined in Chapter 5 of our constitution, which categorically states that no person shall be deprived of his life intentionally,
We're having a problem again with his internet, and
at this point,
go ahead.
I want to say that we need to take just one or two questions from people. I noticed a comment here from our very own Cosropin coordinator in Lagos coordinator. And she says, congratulations to Cosropin for a successful webinar. We should all continue to create awareness on the plight of the older persons. I also noticed one of our coordinators, coordinator for Southwest, our own very own architect, Williams. I also noticed she is here. But in the meantime, if you have any questions, could you just type it on the chat room, put it on the chat room, and we'll see whether we can take it before we take our closing, before we close. If you have any question, yes. I'm afraid we might not continue to take you anymore.
Okay, sure. Thank you so much for the opportunity.
But it's wonderful, thank you. And I'm glad it's on slide so we can circulate it later.
Sure, sure, thank you.
Sorry, I will plead that we hear him. He is the only one that has addressed, he's the only one that has addressed issues about access to justice. Of everybody, we have talked about everything. Please let us hear him. Please,
all right, popular opinion says that we should hear you, sir.
Let us hear him.
All right. Paul, can you continue?
Okay.
Continue.
So thank you very much, my brother, for the advocacy to continue on the access to justice. Yeah. I think I'm very grateful for the opportunity given once more. And so as I was so as I was saying, apart from the Constitution giving the civil rights to individuals, there are also particular clauses or sections within our criminal code that make sure that offenders are being punished for abuses that are visited on any other persons, including our elders in society. Of course, we have structures within the Ghanaian justice system where the police, under the Domestic Violence and Victim Support Unit, under the Ghana Police Service, is making sure that issues about abuses about older women, about older people are brought before their systems for proper prosecution. We also have the family and juvenile courts. These are specialized courts for issues that borders on abuses at the community level, at the family level, including abuses on the rights of our older persons. Of course, we have the Ghana Prison Service, making sure that culprits are well, confined to the walls of society. Said culprits are apprehended and put into bars for the nasty things that are being visited on our older persons. We also have the parastatals, such as the Commission for Human Rights and Administrative Justice, making sure that they investigate, they prevent, and then punish culprits in terms of abuses that come before their decks. We also have the Legal Aid Board for people who do not have the resources to hire the services of a skillful lawyer. So the Legal Aid Board comes in with lawyers, with their paralegal people, making sure that they do the proper investigation and make sure that culprits are brought to book, and then the victims are well compensated and ensure access to justice. Of course, informally, the Constitution also recognizes the role of our chiefs. So the Chief Palace also serves as a mediation center for people who are accused of witchcraft, whose rights are being abused, to go there for redress. So in most invariably, these chiefs serve as a source of mobilizing force. They make sure that they disseminate information to those at the grassroots to make sure that issues about abuses about older people are well shunned, and then these people are well integrated into society. Of course, we have NGOs and CSOs like the Corrupt Ghana, of which I'm the executive director, making sure that we drum home about these abuses and infractions concerning the older people's rights. And we also have the LPH Ghana, we have Federation of Women Lawyers, FIDA, making sure that they have finding machines, they have referrals, influencing social policies, and raising awareness, all to make sure that our elders have access to justice. Of course, there are a lot of challenges within our system. The state, the very people that are mandated to ensure that we have access to justice are underfunded or under-resourced to perform their daily duties. In most cases, too, they do not have shelter they do not have the structures to shelter our elders while processing their cases for, justice. Whilst state institutions require victims to file complaint themselves, complainants' victims often frail and weak to lead the process of seeking justice by first reporting. Our elders who are often abused are very weak and feral, so they even feel reluctant of leading the process of investigation, let alone prosecuting the victims. Of course, criminal trials and proceedings are also truncated due to lack of evidence gathering or reluctance of family or community members to testify against suspected culprits. So more often than not, people think that these are family issues, so these are sentencing matters, so they wouldn't want to betray their family members. So these are confined to the community level, making sure that the older people do not seek access to justice. Of course, there's a lack of political will to prosecute perpetrators who have the full support of community or traditional leaders. There are people who are very influential in society. And so if you touch them, you are likely to touch skeletons, so you are likely to open the Pandora box of issues to happen at the community. So these are some of the challenges that hinder adults to access, older adults in accessing justice. To my conclusion, I can say that all these foregoing issues that has been highlighted by previous speakers and discussants points to an imminent crisis of elderly abuse. And we need to proactively, the word over here is proactively, make sure that policy interventions are introduced to affect them in timely manner. On this note, I'll call upon all the relevant actors and stakeholders for us to work together, no matter our geographical standpoint, to make sure that we bring these abuses to a halt, to make sure that our elders live with dignity and with respect. Thank you so much for giving me the platform once more.
Fantastic, fantastic. That was awesome. In fact, I'm so glad that you spoke to the end, You know, I found out that out of all the 6 countries that presented, your country has the highest and best judicial system at, addressing elder abuse. So thank you so much.
Thank you very much.
That's not
altogether correct.
So well detailed. Thank you so much.
Thank you very much.
I also say that your conclusion is our conclusion in Cosropin, that we all work together no matter the geographical divide. And it's so beautiful to find out that all the people I contacted or we contacted were very, very willing to be part of this. And that was awesome. We at Cosropin knew, were amazed at the response. So that I don't say more than I should say, at this point, I want to call on our very own Dame Engineer May Ikoku to come and get what I almost started doing. Thank you so much. Over to you.
Yeah. Good afternoon. I wish, okay, so my time zone. I wish to give my profound thanks to all who participated, starting from the Honorable Minister Sadia Omar Farouk, the Honorable Minister of Humanitarian Affairs, the Director General of the National Senior Citizens Center, Dr. Mrs. M.M. Omakaro, who is one of our own, she's one of our fellows, one of our board of directors. And I find the Honorable Minister of State for Health, Dr. Oluromi Mamora, represented by Dr. Nneka Oji. Thank you very much. I also wish to extend my thanks to all those who accepted our invitation to speak. There are so many of you. I don't know if I can read all. Mrs. Victoria Awomolu, SAN, Eli Mogawishna of Rwanda, Dr. Osiobu of Nigeria, Mofubelo of Togo, Olainka Ojemalo of Nigeria, James Konitia of Kingbe of Nigeria. Unfortunately, Joyce Kairu of Kenya could not join us because of network, but she accepted the invitation. Mary Ikoku of Nigeria. Not my mine is spelled differently. More Nigerian than South Africa. And Teiko Tago of Ghana. Thank you very much. And also for encouraging all of us to work together. The people said it was wonderful. These are from our chat. Another one said, this is my first time of participating. I'm so happy this topic is being handled. This is great awareness. I am in the US. Another says, quite enlightening. Congratulations, Cosropin. Another says, awesome. That's from Mr. Paul. It's been wonderful. It's been wonderful having you. Big thanks to the organizers. Well done. Another one, thanks for the slides from Ghana. Another says, thank you for inviting me to this webinar. I have thoroughly enjoyed myself in this session. I leave you completely converted. And I think we are promising you that the soft copy emails. Once we have your emails, we forward all the webinars, all the soft copies to everyone. It has been educative, even for myself, too. Thank you very much for participating. Let me just read one last comment. It says, this is a great meeting. I attended because I needed to know more on how to motivate those caring for my aged parents, mother-in-law. I understand now that both parties, aged and caregivers, go through some level of abuse and are to be catered for. in their unique, different ways. I know better now. Thanks to the organizers for this wonderful opportunity. Great event, Cosropin'. Thanks to my elder sister, Tina Chukwuka, for me. And thank you a million to all the speakers. You all did well. These are comments from people. Thank you very much. On this note, I also thank the conveners, Senator Dr. Eza Joku, who is the president of Cosropin', and the programs coordinator, Reverend Architect Vic Honor, for putting this together. It has been marvelous. Thank you very much. We look forward to more of this in the future. Bye-bye.
At this point, we want to just say another fast closing prayer. We thank you, Lord, for taking us through, and we ask that next time we'll have more people experience a great conference. Thank you. All my from everywhere in Africa.
It's from here.